Alright, so we are moving to the next aspect of orthopedics, and here we are going to discuss what is known as what? Limb realignment. Limb realignment. Okay, so I was actually getting confused. Let me just state it out because another student out there might be having this issue. I was thinking realignment has double L, but it's actually one L. So for this limb realignment, you just have to do it. You are trying to reposition the leg after trauma, after injury. You are trying to reposition it how it was before. Okay, how it was before. So it's just a surgical procedure. Of course, you are trying to correct deformities in bones and joints of the arms, joints of the legs. Okay, most at times. All right, not most at times. We are talking about limb. Of course, limb is the lower limb and the upper limb. So it's often used because you want to readjust the position. Do you understand? You want to improve function. You want to reduce pain. So maybe arthritis, congenital deformities, or the person has had any of the traumas. So what is limb realignment? Typically involves osteotomy. So you are trying to cut. You are trying to reposition the bone. The goal is you are trying to shift the mechanical axis of the limb so that the weight and stress are distributed all across it. Do you understand? So common types of deformities that might actually require limb readjustment is all those varus issues where somebody's having a crazy bow leg. Okay, valgus issues, you're having a knocked knee. It's like this guy had a knocked knee before. This one is trauma, but knocked knee, just that everything is coming to join. Rotational deformities, limb length discrepancies. So sometimes one leg is longer than the other one, so you're trying to actually adjust this. So surgical techniques that you do before you now align it: closed wedge osteotomy, open wedge osteotomy, derotation osteotomy, gradual correction. All right, the joint surface elevation. So all of them, don't worry, I just listed all of them because later on we'll have special lectures on it. Okay, so benefits: it relieves pain, improves mobility and joint function, prevent any further joint issues. The person will now be having a better posture, okay, and be able to maintain a better gait. Okay, so that's what we have for limb realignment as a way of introduction to this concept.